Greetings, everyone. Before I go any further, I'm going to ask you to share this video because if you are Jamaican, there is a great possibility that you have a family member, a loved one who may have experienced some of the same things that I'm going to talk about. And if I am to use my platform in any way that is beneficial, not just to me, but to other persons, I would be serving my community by speaking on the topic that I'm going to talk about. In my last video, I talk about, the shortfalls that exist within the medical system as it relates to mental health. But we have to keep things balanced because we know if you live in North America, if you live in Europe, the likelihood of you surviving, you know, medical emergencies or certain health problems is very likely, very strong likelihood that you will get good medical care in certain parts of the world. But we can't say the same thing about Jamaica. And that is what I'm going to talk about today. Now, Cookie Mama, big up yourself. We had a conversation today, and I want to say that I wish I could be as positive as some people are in terms of the the trajectory we see for our country, Jamaica. In terms of violence, in terms of wealth creation, as was promised. But as time goes on, it's getting worse. Many of our loved ones have lost, friends, family because of neglect. Not just on the political front, but in terms of medicine and accountability and availability of good medicine for the Jamaican people. So I'm here repping for the Jamaican people, and I'm here to call out, some of these doctors. And I'm going to say without any apology that there are doctors in Jamaica that are not qualified, they're not board certified. They are allowed to come into the country and practice medicine, and they clearly have no education. They clearly have no real expertise in any of these areas. Now, it can happen anywhere because here in Canada, due diligence have caused them to show that their doctors will come from places like India, for example. And this is not to discriminate against people from India. I'm just talking about the incidences of individuals who provide the government with fake documents to say that they're doctors. But, in these parts, people are going to do real checks and balances. And so these ones are often exposed. I'm here to expose some of those same doctors that are in Jamaica because we're losing our loved ones. And a lot of times people just say, oh, well, they're sick and they pass away. And they don't know that it's because of negligence. Negligence from the doctors that caused their loved ones, our loved ones, to perish. So at the moment, I'm speaking on the behalf of my own family member. And the purpose of doing this, I think she wants and deserves justice for what happened to her. But before I get into detail, and again, when it comes to the medical things, I don't like to give too much information about someone's medical situation, but I'm going to give enough for you to understand why I'm doing this video. So I have my notes here because I had to do some research based on what occurred. I'm not going to call out to the politicians because they don't care. And I'm just calling out to the citizens of Jamaica to pay careful attention, to your health, and do not see the doctor as an authority figure. Your health is wealth, and it is your responsibility to ensure that whatever you're given, you have enough details about these medication that you're taking. Also, it is imperative that you get second opinion from these doctors, especially a lot of these doctors that come to the country in recent times. You can't depend on them. to take care of your well-being and your health. You have to want that for yourself. Okay? Now, I'm going to talk about a drug, and I'm going to give you a little detail about this drug. And as I go further in the video, you'll understand why I'm sharing this information with you. So, family member went to the doctor recently because she was having some problems with her ear, pain in her ear. And when she went to the doctor, she ended up in a near to death experience where she had to do immediate surgery. Okay? Now, the medication we're talking about here is called Voltaren. She was given a Voltaren. I don't know if that's how you pronounce it. Voltaren, Voltaren shot. And I'm going to tell you a little bit of what this drug is, what it's used for. So Voltaren is, the brand name is called diclofenac. And it belongs to a class of non-steroidal, steroidal, anti-inflammatory drugs. It is often used to relieve pain, tenderness, and stiffness caused by osteoarthritis, and the most common type of arthritis and rheumatoid arthritis. So this medication was given to this family member who went about her earring situation with her ear, pain in her inner ear. Okay, so this Voltaren is used for, pain. It seems related to knee pain, shoulder pain, wrist pain, back pain, muscle pain, joint pains. Now let's look at the side effect. This shot affects the likelihood, or the side effect of this affects your blood pressure. Voltaren infection could be irritating the muscle cells that and pushes in between the muscle tissue, stretching it, to which it can cause inflammation. So when someone is given this, injection, what could be an adverse reaction or effect of this is that, the person would suffer infection. Okay, it can damage the nerve of the skin, cause it to swell, and the patient can lose sensation in the area where it's applied. There's an increased risk of heart attack and stroke. There is an increased risk of stomach or intestinal bleeding, which can be fatal. So an earache, are going to find out why she was having pain in her inner ear. She gets this shot and end up in surgery. This is a drug that is discredited because of the adverse side effects. So diclofenac, sold under the brand name Voltaren and a few other names like Cambia, is likely to cause heart attack. And I'm repeating this. It is a discredited painkiller, and it was pulled from the US market in 2004. GSK and Novartis was asked to pay over $4.5 million in penalty over claims that people were hurt. So the makers of this drug had to pay penalties of $4.5 million for breaches of the Australian consumer law. My question here now is this. Did the doctor that administer this needle to the patient, did the doctor explain these side effects? Um, did the patient get to decide if the risk outweighed the benefit? And the answer to that is no. The doctor did not explain it, and the patient didn't have the opportunity to decide if they wanted it, if it was more risky than beneficial. Now, 15 countries include Canada, Australia, China, Pakistan, and Vietnam have rejected this medication. As I said, it was withdrawn from the market 8 years ago, and there was an international call to withdraw it. Now, let me lead with another story. Some years ago, I went to Jamaica and I was getting the flu. I was coming out of the cold and, in the heat. So I was feeling sick. And I went to a local doctor and he gave me medication. But I usually like to do my research on my medication before I take them. So he gave me one pill. Well, he told me to take two. But I decided to take half of one because I was really feeling bad. So half of one pill until I get a chance to see what the side effects were. And that night, I literally heard my heart. I woke up hearing my heart pounding so hard, I could hear it echoing in the room. It was the most frightening experience I ever had. And when I went back to the doctor the next day, I said to him, my heart felt like it was popping out of my chest last night. What is it that you gave me? Because I didn't get a chance to research it because where I was, I didn't have access to the internet. And he says, oh, I forgot to tell you that it could cause a heart attack. I went there with flu, and this is what he gave me. And some years prior to that, a relative of mine was sick, and she went to the doctor. She stubbed her toe. She went to the doctor. He gave her medication. I thought that was very odd. And so I said to her, do not take that medicine until I research it. Well, of course, she felt sick. She was in so much pain. She took it the night before I called her back. And when I called her, she said she had a horrible night. Her chest was on fire and all these horrible symptoms. When I did my research, it was a drug that was banned in many parts of the world. And it was made from things like pesticide and so on and so forth. So you have these medications that are expired, that are sent to Jamaica, or these medications that are deadly, that are removed, that are not supported by any drug administration around the world. These bodies are here to protect the people. But in Jamaica, what bodies are there to protect the people? So when someone like this doctor who administered this shot to this lady gives her medication that is banned in other parts of the world. And not just that it's banned, but the fact that she goes in for earache and this person gives her something that is used for arthritis. Now, what is the recourse for her? Because now she's literally disabled and will need time to heal. I mean, when they did the surgery, when I see pictures of this, I mean, her skin is lacerated. They had to operate. And the flesh where the injection site was so damaged that they had to cut out that area. And she's supposed to just go off after she has been injured by a very careless doctor. In my opinion, I don't even think it's a doctor because there's so many of them in Jamaica operating, just doing as they like. And so when someone goes in to see the doctor or, for simple things, they die and nobody thinks anything of it, not knowing that these are adverse reaction to these medications, oftentimes that are banned in other parts of the world. When she went to see him, she didn't get it for free. Healthcare is not free in Jamaica. She had to spend her money. And, these doctors take Hippocratic oath, as they call it, to protect their patients. And what they're doing is worse than what the criminals are doing in Jamaica. And does he follow up? In fact, when she calls him after she gets home and she's really responding to this thing negatively. She reaches out to him to say the swelling was there and she was in a lot of pain. And he says, don't come back, just use hot water, which made it worse. So I'm calling upon anyone who is listening to this video who's in a position to address this situation, to address it. I'm not going to say what my intention is. I'm not going to say what the plan is going forward in terms of what this doctor did. But to anyone else in Jamaica who have been injured by a doctor that you go to help you get better, it's time for people to start responding to these individuals, especially if you live in North America and you have your family. You're going to have to really pay close attention to the medications that they're taking. You have to really help them manage their health, because nobody in Jamaica, and I'm just saying it in general, who's there to protect the people? So the more we talk about these issues, the more we talk about, the state of the country and what's happening, these individuals who are in positions of power, they're very cruel, very wicked, and who's paying the price? This woman is suffering in agony and pain because of what a doctor did to her, and there's nothing about this person, no integrity, no level of professionalism that you can look at and speak about. Because if you hurt somebody or if you made a mistake, it's your job to reach out to that person and make sure that they get better. He is the one who is supposed to pay for her hospital bill, not her. She didn't injure herself. He made a colossal mistake, and I don't know if I could call that a mistake. How many of our people in Jamaica are at the hands of these butchers, going into the doctor for simple things? How many of our family members, our friends, our relatives, our neighbors are going in for simple treatment and not leaving? And if they do, end up with permanent, disability. What can we do? When are we going to start holding these persons accountable? All the talking these days, I'm tired of talking. When it comes to our people, we've gone through so much trauma in life. We go through so much suffering, so much pain, so much anguish. And we live our entire life. Some of us live our entire life, suffering at the hands of people who claim that they're going to help or that they care. In the past, I would be calling or appealing to the government, but we see what they're about. I just want to highlight this. I'm going to say to anybody, do not take this Voltaren medication based on the research that's on it. If you're going in for a simple procedure or you're going in just to find out what's going on, it is in your best interest to find out what is being administered to you and to do your research and to get a second opinion. There are great doctors in Jamaica, absolutely great doctors who still care about their patients. But it's time for the government of Jamaica to start looking carefully at some of these persons who come to the island saying that they're doctors. They have no degree in that area. There's a lot of doctors in Jamaica operating, with fake papers. And that's something that I want our people to be aware of, to be cognitive of, because, listen, they are creating all kinds of pain and suffering for our people. If you've had any experience with going to the doctor, seeking relief for your pain and suffering, and it end up being worse, share your opinion in the comment, or your experience for that matter. If your family member or your loved ones, have endured these kinds of suffering. And I'm also going to say that it's time that we start writing these letters. We start holding these persons accountable. If you cause, because of your action, your patient to suffer, well, there should be recourse. And the people need to know that because you don't have money or you're considered to be poor, please understand that you still have rights. And people can't just do as they like with you, administer, meds that cause your symptoms to worsen, or, for you to lose your loved ones and they ride off in the sunset. You have to hold them to task. And so, I feel so much empathy for this loved one of mine, my family member, of my husband. It's just heartbreaking, the pain and agony that she's going through right now, and just sitting there looking, and this man is free as a bird, or he thinks he's free, but he's going to be exposed. I didn't name his name in this video because I need to do some more research. And, some of these things you have to be careful about before, you call people's name. I'm still doing my research, but I just wanted to enlighten you all and to tell you to be very careful in Jamaica. No one is there to advocate for yourself. For you, for example, you have to just advocate for yourself. And you can't just see these people as persons of authority, that they know everything. They don't know everything. Some of them are very dangerous and they only make things worse. Okay? Please like the video. Please share it with someone. Warn people about this medication that has been given, and so many more medication that's been banned around the world, that is sent down to Jamaica. People are experimenting on our people. People are doing things to, I'm going to hold that for now. Stay blessed.